This is Sir Alexander Fleming. In 1928, he discovered the first antibiotic drug, penicillin. Since then, antibiotics have transformed human lives. They have cured infectious diseases like miracles. They have made medical procedures like surgeries simple. But when Dr. Fleming received the Nobel Prize, right here in Stockholm, he made a warning. He said the thoughtless and the unnecessary use of antibiotics will lead to bacteria becoming resistant against these medicines, will lead to infections becoming fatal again. And this warning has come true today. As we have poured antibiotics onto bacteria, in the sense of killing bacteria in community, in healthcare, in agriculture, rather thoughtlessly, the bacteria fought back. They developed resistance, and this resistance spread. And today, we are in an era where there are bacterial species that do not respond to a single antibiotic. This has led to simple infections caused by skin injuries becoming fatal again. Personally, I come from India. It's one of the worst affected countries in the world because of antibiotic resistance. The World Health Organization has predicted that antibiotic resistance might be the biggest healthcare threat, surpassing cancer in the next few decades. We need new solutions, effective solutions, smarter ways of fighting these infections that do not add on to the resistance problem. The answer to this might actually lie within us. Our immune system is one of the most powerful and the sophisticated systems in the world that can target and specifically kill bacteria. And they have been doing this for millions of years, protecting us. A healthy immune system fights bacteria in one specific way. They target the membrane of the bacteria, the skin of the bacteria, if you may. Let's take this bacterium, for example. This is how its skin looks like, the membrane. What the immune system does is that it targets this membrane. And the way that it does is that when it comes in close contact with the bacteria, it releases something called antimicrobial peptides. These are small molecules, as you see here, like the red springs. They are designed to basically drill a hole through the membrane of the bacteria. It physically disrupts the bacterial membrane. It's a physical stabbing effect. And it works regardless if the bacteria is resistant to conventional antibiotics or not. Can we transform this concept? Can we transform this idea of antimicrobial peptides into functional therapeutic products? Can we, for example, form a medical device that can maybe prevent an infection in skin wounds, for example? In our research, my colleagues and I developed a methodology to take these peptides and chemically bind it to a soft material. And in the process, we developed a new material that when it comes into contact with bacteria, regardless if it's resistant or not, it rapidly kills it, sort of emulating the way the healthy immune system fights infections. You might still be wondering what this really means. As an example, a first product that would be based on this technology might be as simple as a new form of Band-Aid, a plaster, a wound patch, that when people have decreased immune system can use this to fight off bacteria in skin injuries and prevent infections. It might be very important when the risk of getting a resistant infection is high. Today, we have moved this from the research phase and started up a company called Amferia to bring this out into the market, to bring this out into the clinic, to fight antibiotic resistance. But before I finish my talk, I want to show you what this material can do to bacteria. What do I mean by killing bacteria? I'm going to show you a few images of real bacteria multiplying in real time. And this is exactly how it happens in a wound. Focus inside this white circle. You will see green dots appearing. These are live bacteria, real bacteria that are multiplying in real time. And as time goes by, they grow, they multiply. And this, if it's in a wound, means that you're heading for a serious infection. Now, when we bring this patch in contact with these live bacteria, something really drastic happens. The entire population turns red. And red here is that the whole bacterial population is dead. And you will also notice that it went from these small dots to flat discs. So these peptides are basically exerting a physical force on these bacteria and killing it almost instantaneously. So if this is a patch, basically removing all the dead bacteria along with it. And we have tested this against the most dangerous resistant bacteria known to us. It works exceptionally well. This idea comes out of years of research conducted at Chalmers University in Gothenburg. And today, we have started up a company, a small company today, to translate this idea into the clinic and hopefully bring it out to everyone in need. Because in the fight against antibiotic resistance, we really hope to make a difference. Thank you very much.